Hello everybody. Welcome to Preventive Cardiology and Rehabilitation series. Today we are going to talk about very important topic which touches every home, diabetes. Joining us today Dr. Mahesh, who will give us more clarity to this disease and also decode many myths in this disease management. Welcome sir to the Preventive Cardiology series.
Hi everyone.
So the first question sir, that many a time nowadays we are doing a blood test and we find out that our blood sugar or HbA1c levels are high, and that is when we take that seriously and go to doctor and find out. But do you think that is there any metabolic factors which we should look into prior to all of these things rising?
Yeah, I think you've introduced a very important word called metabolic. So it is the metabolism that changes first before the onset of any disease. So that's why we use the term metabolic syndrome, which is actually a precursor to developing diabetes, where you will detect through the blood test. So how do we detect metabolic syndrome? They are also known as silent killers or silent symptoms, where we have symptoms that are non-specific like fatigue, tiredness, feeling hungry, or tiredness after a meal, and sometimes early morning shakiness. So these are common symptoms that we can see and we ignore them as, maybe something I'm stressed out. But actually they lead to metabolic syndrome, and then which progresses to diabetes. So in metabolic syndrome we can easily detect it because we see weight gain, BMI is increased to more than 23. We also have waist circumference increasing, and along with that the triglycerides may go up, the blood pressure may go up. If you have 2 out of these 4 or 5 things, then we call the person as having metabolic syndrome. So these are the important things that we need to understand even before the onset of diabetes, and HbA1c of 5.5 or more than that is what we should look at to make changes in our lifestyle to actually before moving on to diabetes, where it is when we see a 6.5 or more than that.
Yeah, many a time like in rehab also patient comes and they tell us that we had seen these problems but we thought our HbA1c is fine and we didn't look into. So do you think that how important it can be for especially for people who have genetic history or family history, or if they have any PCOS or fatty liver or things like that, do you think they are already at risk of diabetes?
Yeah, I think you made a very important point that people with PCOS, fatty liver are considered to be an independent disease. They are all part of the metabolic syndrome, where we see patients with family history thinking that I will get diabetes and they don't take any steps. Actually, genetics is not destiny. In fact, it is the first step to take action towards preventive health. Even though you may be at genetic risk, if you take steps to prevent diabetes, it will also prevent the other metabolic problems like PCOS, fatty liver, high cholesterol, even high blood pressure is a part of these metabolic syndromes. So we need to take action and steps that will prevent these in the early stages, so that we don't get cardiometabolic problems in the long run.
So do you suggest any screening tools in this area which we should do in prior to make sure that if we have genetic history then we can prevent it prior to it?
Yeah, I think very important is to measure the waist circumference. Anything above 90 cm in men or 80 cm in women is considered to be abdominal obesity. We also have another tool called as the waist height ratio, which is very simple. It is independent of male or female. If it is more than 0.5, it is considered as the first step of metabolic syndrome, where abdominal obesity is the precursor of most of the metabolic problems. Along with that, we always check for the fasting glucose, measure the blood pressure, check the triglycerides, and do the HbA1c. But simple things at home with the help of a measuring tape is just to look at the waist height ratio. If it is more than 0.5, the first step you should do is change your lifestyle.
And another very common myth we find out is that if my sugars are high, then if I cut off my rice and sugar, then I'm fine, I'm managing my diabetes. Do you think it is the correct way to manage it?
Yeah, most of the people want simple solutions. They want to cut one thing out of their eating habits, and they think that it will solve all the problem. But in fact, when we want to see about diet, it's not just about rice or even the sugar. It is the total composition of the food, where we Indians have become carboholic. We use the word called carboholism, where we are consuming too much cereals, and recently I saw a newspaper called a cereal killer, which is that we are taking too much carbs, which is complicating our metabolism and leading on to insulin resistance and all the problems related to that. So the first step we can take is to cut off the simple carbs, increase the complex carbs, and increase our protein intake and fat. Healthy fat is actually good for us. Not only this, the sequence in which we eat also actually makes an important difference. If we start with complex carbs like vegetables and fruits, and then move on to proteins, and then finally take the cereal, we can actually reduce the glucose excretion by 30 to 40%. So choosing more protein and healthy fat over carbs and changing the sequence of our eating will actually make a difference in our metabolic health, and I think that is the first step towards overall improving the metabolism in our body.
In diet also, sir, we have seen many a time people come with this fad diets, like they are going extreme into just eating protein and things like that. Do you think it is something which diabetic person or who is at risk of diabetes should try?
So these fad diets are a tricky thing because many people find rapid results and everybody wants a quick solution. But metabolism is a lifelong process. If you want to change your metabolism for your overall health, you want to live a life that is metabolically healthy for years together. You don't want to be healthy for 2 weeks or 4 weeks and then end up with a problem again. So these fad diets are probably a guide towards how to change your lifestyle. Sometimes we do recommend that when somebody is planning an event, like somebody has PCOS and they are planning pregnancy, we usually tell them to go on a very strict diet so that they lose enough weight to plan pregnancy and go ahead for that. But otherwise, these fat diets are sort of a negative thing indirectly, because you do it for 2 or 4 weeks or 6 weeks, you see results, then you stop, you go back to your old habits and you end up in poor metabolic health. So these fat diets are better to be restricted to guided care, and it is more important to change your entire lifestyle in order to live a healthy life.
Correct, sir. Like many a time we also tell to patient that after your meal try to walk. So carbs with movement will be the better choice rather than doing this. Another thing we see is that once one person after diabetes is on medication, they feel that once we start the medications means we have failed into our process, and my sugars are coming normal means I am fine, I am not a diabetic, and they stop. Can you explain that how dangerous this can be?
Yeah, I think the best word that you said is how dangerous. It is in fact very dangerous to do this, not taking the medicine early, and if you take medicine, once you see the sugar is normal, stop the medicine. So these two are very bad things. So in fact, we actually see patients who have high sugars, we start them on insulin, we start them on multiple medicines, and giving medicines early actually brings down the glucose, reduces the inflammation, and in fact gives more time for pancreas to heal. And this has led to we stopping medicines. In fact, in many patients after a year or two, we have stopped the insulin, we have actually stopped the medicines also, and they are doing well with their lifestyle, continuing to improve their overall diabetes. But that is done in a gradual process. The another thing that happens is if you suddenly stop, you may be at very high risk of getting high sugars, which may lead to infections and other risks that may be associated with high sugars, especially diabetic ketoacidosis. And in fact, it can also affect the heart and cause arrhythmias. So it is very important to take the medicine early and actually get the legacy effect. You see, we give legacy. So early glycemic control gives long-term legacy, where we see 50% reduction in the overall cardiovascular events that occur in these patients who start early medicines.
Like even another thing we see that once they start medication and all of it, but they want to start exercising. This is another aspect where people have no idea that how to approach and how to start things. So they feel that okay, once in a day if I'm doing 30 minutes of walk, that should be fine. But do you think that sedentary time is a bigger issue here?
Yes, sedentary time is the right word that is being used here. Sedentary time in fact is actually even more dangerous than what we think it is. So if you sit for 2 hours, it actually starts the inflammation because your circulation has come down, and when your circulation is not good, the body thinks that there are waste materials accumulate in our blood and then they stay in the muscles, and it leads actually to inflammation, and actually that causes insulin resistance. So the simple thing that can be done is move 1 or 2 minutes every hour is the most important step that you can take. Along with that, if you had 30 minutes every day of walking, it actually makes a difference. But moving is more important than just sitting, and even standing for 1 or 2 minutes after an hour makes a difference. So that's why we always tell patients to keep moving along with the exercise that they want to follow.
Yes, sir. Even in rehab, we make sure that it's not just that they are doing endurance training. We also try to add like a lot of strength training, because strength training works amazing in insulin resistance. And also many a time people don't understand that they want to go for a morning walks, but if your fasting is very high and if you are going for morning walks, that can also deteriorate the process. So rather than going on a morning walks, we generally suggest that you go after your heaviest meal of the day. So even time matters when you are doing the exercises. We also see that with strength training and endurance training, whenever we are combining, we see a lot of good result and faster result as well. And even we in rehab, we also try to make sure that we are checking the sugar prior to the session and post also. So that gives us clarity that what type of training which will work for that individual. It is not going to be like everybody will have same exercise if they are diabetic. So if it is increasing or reducing, according to that also we change the type of training or the timing of training as well.
I just wanted to add to what you said is that the most of the time when we talk about exercise, people think that moving the body is enough, and they think if they don't know anything, then they'll move on to yoga. How do you actually use the combination of these endurance and strength training when you advise how much, what is the quantification of this that is good for most of the patients?
It's a process. When they come to the rehab, we have to test each and every individual. We see their capacity, muscle strength and the general capacity, how their heart rate and BP is increasing, reducing. So monitoring is something which is very important. Otherwise they are going to end up into hypoglycemic attacks and they will discontinue the rehab or the exercise, and they will not able to continue to have those benefits which they were gaining. So I think monitoring and the assessment and also personalization is something which is the right approach we take, and try to see that which training when to introduce is something very important, I guess. So coming to hypoglycemia, do you think it's very dangerous, as we all know, but what do you think, how can we tackle it in a best way? And do you think CGM type of newer technology will help into it? And what is CGM, if you can tell to our audience?
Exercise is definitely one of the important contributors of hypoglycemia. Hypoglycemia is an important symptom and it is dangerous. I think most of us, people who know diabetes, know that. So hypoglycemia, one of the important reason is when you do exercises without monitoring your glucose level, or you overdo the exercise without pre-snack exercise, leads to hypoglycemia. Along with that, skipping the meals or taking medicines and delaying your meal are the common reasons why you get hypoglycemia. Along with that, many patients, they consume alcohol on an odd time without taking meal, or they skip their meals and take alcohol, and some may have liver or kidney issues. These are the important reasons why hypoglycemia occurs, and that's why monitoring is very important. And monitoring, we have glucometer, lab tests commonly, but actually we have a revolution in terms of the monitoring system that we have, like you said, continuous glucose monitoring, or simply called as CGM. CGM actually gives us the excellent ability to monitor the glucose without worrying about pricking or going somewhere else. And actually in the last 6 months to 1 year, the important introduction into the CGM is the alarm system. So if the glucose goes high, the alarm comes to your mobile, it rings, and if the glucose goes low, then also we have an alarm. So you can actually look at your lifestyle and your eating habits and exercise monitored at the same time, along with the alarm that can alert you about low and high sugars. So it is actually a good package when you actually use the word called personalization. Yes. CGM is one of the best tools to personalize the care, where we can monitor their eating habits, exercise, and also look at their glucose levels. It gives a good insight into that individual, and then we can tailor make whatever our prescription is regarding the lifestyle changes along with the medicine for the same.
And many a time we are seeing that in cardiac rehab, many patients who are diabetic and ended into cardiac disease, or had an heart attack and now got diagnosed with diabetes. So can you tell us that how complicated this diabetes can make the cardiac recovery?
Yeah, cardiac recovery is very important, and for that we need to help the patient. And one of the best ways to help the patient is to have good glycemic control, because poor glycemic control or high sugars can worsen the plaque formation. It will actually accelerates the plaque formation, and thickens the blood vessels and in fact delay the healing. This also leads to inflammation, where we have seen many patients who are having poor control come back with another cardiac event within a short period of time. So it's very important to monitor your glucose levels, take the medicines on time, and choose medicines that do not lead to hypoglycemia very often. So in that regard, we have two good medicines with us known as the GLP-1 analogs and the SGLT2 inhibitors. Both of them actually do not cause hypoglycemia and they are good for the heart, along with the reduction of the blood glucose. They actually also help the renal parameters also. So it's a cardio-renal metabolic drug that should be preferred over other drugs which do not cause hypoglycemia, and monitoring well and taking the medicine on time will actually make a difference in recovery of these patients.
Yes, sir. And even from many long time ago we used to hear this. Now the people are still taking steps for prevention or for the treatment, but is this statement true that once a diabetic always a diabetic?
Yeah, sort of. It is partially true. Once you have diabetes, definitely you are a diabetic. The only difference is whether you are a diabetic, you want to take medicines forever and suffer, or you want to be a diabetic without taking medicine. So changing your lifestyle can actually reduce, prevent and delay the complications. And in fact, I would say once a diabetic, it's always a diabetic with good lifestyle.
Yeah, thank you so much, sir, for such wonderful insight on this topic. So today's message is simple. Diabetes is not just about controlling numbers. With right screening, smart nutrition and good rehabilitation, prevention is possible. So take your steps today.